Hey, what's up everybody? My name is Brandon. I'm a pediatric ICU doctor and pediatrician, and today we are talking about dehydration. So as the graph shows, we're in the middle of norovirus season, and what this means is kids are at home, not taking in as much, vomiting, having diarrhea, and essentially are getting dehydrated. It is critical for parents to be able to recognize signs of mild, moderate, or then severe dehydration so you can respond appropriately and get kids the care they need. So let's get into it. And this is commonly caused in children by norovirus, rotavirus, adenovirus, then some others like sapovirus. But in general, when you have this illness, there's really nothing that you need to do other than support children and avoid dehydration. And so that's going to be our focus today. Usually when you hear this story, it's not just the child, but everyone in the family has nausea, vomiting, a little belly pain, low-grade fevers, and diarrhea. So at the end of the day, what we're trying to do is we're trying to make sure that the child just has mild or maybe mild to moderate dehydration, and they haven't progressed to that severe dehydration stage. This is important because mild to moderate dehydration can often be treated in the outpatient setting with oral rehydration therapy, which we'll talk about in the next video. Once you progress to severe dehydration, you really need to make sure that you get your child to a doctor or clinician who can give IV fluids and really resuscitate them. So the gold standard we use for dehydration is basically change in weight from baseline. So if you have the story of a child who suddenly has vomiting, diarrhea, they're not taking anything in, and you know their weight today, and you can compare that to their recent weight when they were healthy, that difference is actually what tells you, man, how much body weight have they lost? And that's likely fluid that tells you how severe the dehydration is. And so the cutoff is really less than 3% is mild, mild to moderate is somewhere in the 3 to 9% range, and then 10% or greater is severe. And so here I've posted a couple examples. We'll focus on this second one. So the average 1-year-old probably weighs 10 kilos or about 22 pounds. You can imagine if they've been sick for a couple days and I weigh them in my office today and they're 20.5 pounds, then they have lost 1.5 pounds. Dividing 1.5 by 22 gives you a 7% loss. And so I would say, man, this child is moderately dehydrated based on this gold standard. Okay, so let's say you don't have an accurate scale at home or don't know the weight perfectly. Well, there are a lot of signs that we look for that suggest moderate or severe dehydration, and we'll go over those now. I would normally start with vital signs, but I'll say this is probably most relevant in the ER, ICU, or urgent care setting. So I'll talk about them at the end if people are still hanging around, but I really want to get to the physical findings that you should look for in your child to identify severe dehydration. We'll start out here with the buccal mucosa, and so this really refers to just like the lips or the gums. And you can see for moderate is when they start to look dry, and then severe is when they're really parched and cracked and dried out. The anterior fontanelle is the other thing to look for, and this is where you're looking for a sunken appearance. So first, what is the fontanelle? Well, remember, when babies are born, their skull bones are actually not fused. And so you have what's called a soft spot here in the front, but you also have a soft spot there in the back. They close up probably around 10 to 24 months of age, but before that, they can give you really nice diagnostic clues of how the child's doing. So we'll look at this first video, and already you can see, I just want to pause the video here, that if you look at the child's head, you can see the skull, and then all of a sudden there's a sort of like indentation. That's already a sign to me that the fontanelle is sunken down, and this is a potentially dehydrated child. And then the other thing that we just talked about was looking at the mucous membranes or the lips, and you can just see that there's fissures and they're just dried, really dried out. I'll play the rest of the video because it really shows them checking the fontanelle and showing how it's sunken. They don't look in the gums in this video, but you can imagine they're likely just desiccated and parched. So this already would make me think that this child is at least moderately and potentially severely dehydrated. And then we'll just look at one more video, and this here is showing the same thing. So again, you can just see this indentation where the fontanelle has a sunken appearance. I would encourage you, if your child is well right now, feel their fontanelle. If they're less than a year old, you'll likely still feel it. Sometimes they close up a little bit early, sometimes late, but if the fontanelle is there, it's good to feel it when they're healthy, because then if they're dehydrated and you feel it sunken, you'll know what that feels like. And then it can also be a sign sometimes if there's meningitis or something going on in the head and you feel it bulge, you can note that as well. Quick caveat, if your child's crying, it often bulges and everything is fine. They're just freaking out, and that's not a big deal. Okay, so now let's talk about the eyes. So I actually want to jump down to tears for the first part. So if a child is crying and clearly upset and clearly crying, but they're not making tears, that can be a sign of dehydration. When they're reduced, it's moderate, and then if they're totally absent, that can be severe. But just remember, if you have a newborn baby, they won't cry with tears for other reasons. So the ducts haven't totally formed. So it's really in those first 2 to 4 weeks when tears start coming out really obviously. So younger than that, something else going on, and that can be normal. But older than that age group, you should look for tears when they're crying for a sign of dehydration. And then the second thing we're going to talk about is the appearance of the eyes. So I'm an old man, got nasty eye bags, okay, but kids who are youthful, they should have skin around the eyes that's relatively plump. The skin here in general is thin, but there's little fat pads that when you're really dehydrated, they can get thinned out. And so sometimes children will develop what's called a sunken appearance of the eyes. And you can just imagine that's just because all this skin and soft tissue has lost the hydration, and so now the eyes are kind of resting back in the head. Okay, so now we're going to look at a video that will show us some examples of when children's eyes appear sunken or normal. And so in this first video, you can see that the eyes seem kind of hooded, and you can see the shadow on the upper eyelid, and you can see it in the bottom eyelid as well, that they both just appear to be sort of set back in the recess of the orbital cavity, and so that would look sunken to me. The second one, you can see that the child appears to have full, healthy looking eyelids, so there's no evidence of dehydration here, either above or below. We'll wait to see the third one. The third one, here you can see again, kind of similar to the first, where there's this hooded appearance to the eyes, and you see that shadowing in the upper eyelid, and then similar, a little bit of a concave appearance down below. And this again would be an example of, sunken eyes, which would suggest moderate or severe dehydration. And then finally in this fourth example, again, the eyes appear full, or the eyelids appear full above and below, and so there's not really any evidence of dehydration here. Okay, so the next thing we're gonna talk about is this idea of skin turgor. And basically, it's just how elastic is your skin. So I'm not sure if this is gonna show, but if I take my skin here and I pinch it, and also sorry, my hands are hairy and really nasty, but you can imagine if I pinch my skin here, that when I let go, it immediately kind of flops back. And I'll do it again. Flops back. So that's a sign that the skin is well hydrated. If that takes longer, we'll say between 0 and 2 seconds, that's usually a sign of moderate dehydration. And if it takes more than 2 seconds, then that's really a sign of severe dehydration. Let's check a couple examples now. Okay, so let's start with this first child, and you can see they pinch on the belly, and this is a good place to check. And you can see it kind of immediately goes back. So this child appears very well hydrated to me. There's nothing to indicate that the skin turgor is abnormal. But we'll go on to the next one. You can see this time the skin takes a while to go back, and it actually takes a long time from my count. So I would say if it's more than 2 seconds, then you know that's a sign of severe dehydration from limited skin turgor. We'll do a third one, and this is kind of somewhere in between to me, so maybe I would call this moderate dehydration, where it doesn't snap back immediately, but within 2 seconds it seems to recover. And then finally, just to bring it home, this is normal skin turgor, where again, as soon as you let go of that skin, it kind of pops back and shows good elasticity, which suggests good hydration. Okay, so now I want to talk about skin. So if the skin is warm and we use the word well perfused, there's nice blood flow to it, that's a good sign. But when it starts to get cool, or even has a mottled appearance, that can be a sign that the body is in extremis. So essentially it happens because the blood vessels are getting constricted in the skin in the extremities to reroute blood to the vital organs. There's something that we check, and I'm going to show you it here, but this is not something you need to do at home, but it's something you might see in the emergency department, so I want you to know about it. And it's called capillary refill time. The basic idea is that if you squeeze, say, a nail bed or a part of the skin, and then you let it go, and we use the word blanch, where all the blood is now out of my finger, and I let it go, you can see that it regains its color pretty quickly. You can imagine that if the blood flow to my finger, or somebody's chest, or whatever part of their body is reduced, then the color will come back much slower because all the blood vessels there are really constricted. So let's look at a quick example of that. And this is normal capillary refill. So they hold a little bit of pressure for 5 seconds, and you can almost see that the skin color goes from blanched to normal quite quickly. Within 2 seconds is what's considered totally normal. And we'll just see one more example here quickly. And yeah, the skin color essentially goes back to normal real fast. To contrast that with an abnormal finding, you can see that the skin here is blanched, so the blood is now out of the heel. And when the provider lets go, you would want to see that heel regain its color really quickly. But you can see that it takes, it's been 5 seconds, 6 seconds. It might take 10 seconds before this foot actually regains its normal color. And so that can be a sign that the body is in extremis again, and constricting those blood vessels at the extremities to reroute blood to the vital organs. Okay, so the last 2 things I want to talk about. First is urine output. As an ICU doctor, I am obsessed with urine output. To me, this is just a window to the body of how well are we doing? Like, are we in trouble or not? And I don't want to oversimplify things, and there's certainly a lot more that goes into it, but if a child is producing urine normally or large volumes, it's usually a good sign that they're at least not in what we call shock, where they're not getting enough oxygen to their vital organs. If they're not producing urine, it can just be a sign the kidneys are starting to get a little bit desperate, and they're saying, man, we need to hold on to all the fluid we can. We can't lose any more urine because we're kind of getting close to getting in trouble. So if you notice at home that your child is not producing any urine, that is definitely something that could suggest moderate or severe dehydration in the right context. And then the final thing, of course children are going to be thirsty when they're dehydrated, but if you start to notice really altered mental status, severe irritation or irritability, agitation, or just confusion, these are all really late and concerning signs of severe dehydration. Okay, so that was a rapid fire of a lot of information, but how do we bring it together? So basically, you look to see, are there multiple signs of moderate or severe dehydration? And if there are, then it suggests that you have a problem. And so, this is a clinical tool that we use sometimes, but on the right side especially, you can see that it really just focuses on, is there an ill appearance to the child? Do they have dry mucous membranes? Is their mouth or gums? And then do they have absent tears and that delayed capillary refill? So with that, you can kind of get a sense of, are we in a mild, moderate, or severe dehydrated state? And that will determine the response by the providers. I would just say, again, nobody needs to truly play doctor or nurse or EMT at home. This is all supposed to be education, so you kind of know how people are thinking and can make educated decisions for your child. But making these decisions is really the responsibility of a clinician, so definitely leave it to them if you have any concerns. Okay, and on the off chance that anyone has stuck through this entire video and they are interested in the vital signs, I'm going to talk about them now, just because this is kind of interesting to me. Of course, this is how we make decisions in the ICU. But in general, so the vital signs that you expect to see change with dehydration, one of the first things is a high heart rate. The idea is basically your heart pumps at a nice slow rate and it's feeling good. When there's not enough fluid around, that affects your blood volume. And so the heart says, man, I'm not pumping as much with each pump as I normally would. And so to compensate for that, it starts to pump faster. So that's one of the earliest signs you'll see of dehydration. And then a later finding would be if the blood pressure actually starts to drop, that to me is usually very, very concerning. You should be able to maintain a normal blood pressure even with that high heart rate. And so that's often a sign that a child is in dire straits and really, really dehydrated. And then the final thing I'm gonna say is about respirations. And I kept this in just because I find it interesting. It's a little counterintuitive. So if your child is really dehydrated, you may notice them breathing very deeply and very fast. You might say, that's kind of weird. They have a problem with their belly, they're not peeing, they're dehydrated. Why are they breathing fast? Well, the basic idea is that when you get that dehydrated and your kidneys aren't getting enough oxygen, your blood essentially starts to become acidic. And this is an equation that you learn in med school and you can ignore, it doesn't really matter. But the key thing is that over here, the carbon dioxide is just a really important component. And so what the child is essentially trying to do is they're saying, man, there's too much acid in my blood, but the way that I can help balance things out is to blow off all of this carbon dioxide. And so they actually breathe faster and deeper to get rid of CO2 and make their blood less acidic. Okay, and then if you are looking at vitals at home, this is just a general reference. So in general, newborns probably breathe 20 to 60 times a minute. It gets slower as you get older, and then adults are somewhere 12 to 20. And then here's just some numbers for in between. All right, so just to bring it all home, call your doctor or nurse if your child has signs of moderate or severe dehydration, especially if they have multiple. If there's diarrhea or vomiting lasting more than a few days, that's pretty abnormal for just a routine norovirus, adenovirus, or something like that. If they haven't been able to keep anything down for a few hours, you want to act quickly to make sure you don't progress to that moderate or severe dehydration. And then, like I said, obsessed with urine output, if they have not needed to urinate in 6 to 8 hours during the day and really haven't had a wet diaper for infants in 4 to 6 hours, you want to talk to a medical provider. Okay, and then this is really just a PSA. So everything we talked about today, I was saying we're really referring to if you have like an acute viral gastroenteritis. Well, there are a lot of other things that can cause vomiting, diarrhea, and belly pain that are much more serious and actually need a different treatment. So some of these things here, if you have if a child has a persistent high fever, blood or mucus in the stool, or blood in the vomit, if there's projectile vomiting, and truly, and this is like hits into the wall type vomiting, can be a sign of an obstruction. Bilious vomit, which is the color you see on the screen here, this sort of like dark green, can also be a sign of an obstruction or something else going on. Altered mental status, like we already talked about. And then recent antibiotics or international travel, it can also often be a sign that there's something else going on rather than just a routine virus. All right, so that was a lot, but I hope it was helpful. If you enjoyed it and it's helpful, please do like or subscribe. And then more than that, I really love comments. So if anybody has a question or any comment on the video itself or other topics they'd like to discuss, I'd love to engage with y'all. So thanks so much. Bye.